as well. Lovely. Well, there it is. Let's make a start. So thank you. Thanks for joining this roundtable discussion. I put a fairly loose header of net zero challenges and priorities. I think that covers kind of most areas that we can talk about. As I said, this session I really want to work for you. So please start thinking about your questions now. And as I said, I've got a few. But without further ado, let me introduce the panel, or let me get the panel to introduce themselves. So if it's okay, I'm going to read them out in order of how the table was that I sent out. So Jonathan, would you mind saying hello? Just a brief overview of your work and how it contributes to net zero, please.
Yeah, thanks, Pete. Afternoon, everybody. I'm Johnny Sylvester. I'm a senior project manager here at Leeds Teaching Hospital, and I am working on our new hospital development. So we are looking to deliver a new adults and children's hospital at our Leeds city centre site. My role, I'm taking the lead from a sustainability and a digital perspective. So I'm looking at the design and the construction of our new buildings, but also how do we factor in the whole life carbon of this structure? So not just from design and build, but through its operation and also from disposal as well.
Lovely, thanks for that. Do you prefer Johnny, actually? Sorry, I could
Yeah, if we could, yeah, that'd be great, thanks.
Johnny, thank you.
Cheers.
Really appreciate your time and your expertise. Keith, hand over to you next, please.
Yeah, thank you, Pete. Hello, everyone. I'm Keith Moore. I am the Programme Coordinator for the Sustainable Healthcare Coalition. The coalition has been around for about 12 years now, and was set up by the then Sustainable Development Unit in the NHS, now the Greener NHS team, to form a bridge between the supply chain, particularly the pharmaceutical and medical devices supply chain, and the NHS, because they recognised then that they can do nothing about Scope 3 emissions without the involvement of the supply chain partners. I know the topic of carbon accounting was off the agenda for today, but the thing that the coalition has brought along is an understanding of about how to footprint, first of all, pharma and med device products, and then how they integrate into care pathways. So hopefully I can bring a little bit of that understanding to your discussions about net zero and how to approach it.
Thank you, Keith. And you know, I'm a fan of the Sustainable Healthcare Coalition. I often attend your sessions. I think you've got your autumn conference next week, which unfortunately I can't attend because it clashes with a training session. But yeah, please do connect with Keith in this meeting, outside this meeting, and check out the work of the Sustainable Healthcare Coalition if you don't already know about them. Tim, another person that I interact with quite a lot, Tim Wilkinson, over to you.
Hello, good afternoon, everybody. My name's Tim Wilkinson. I'm the Sustainability Manager at Harrogate Foundation District Trust. So I am responsible for the management of the implementation of our Green Plan and our travel plan. I'm fairly new into the role, so just approaching 12 months. So I've had quite a fast-paced learning curve. But yeah, pleased to meet you all.
Lovely, thanks, Tim. I should have said this at the beginning, but I've brought some NHS leaders and some industry and some external institutions, and actually I'm delighted to bring Dave Bell from Natural England along. Those that know me know that I'm massively keen on nature. Dave, over to you.
Yeah, hi everyone. Thanks, Pete, for inviting me today. My name's Dave Bell. So I lead Natural England's work on health and the environment. So Natural England is a non-departmental public body with responsibility for improving the natural environment, but also responsibility for how we connect people with nature. So my work really builds on that in terms of the health benefits that provides. But more and more, actually, the conversations I get into are around sustainability and nature-based solutions to the climate crisis. So the sort of win-wins that we can provide by creating more natural spaces for people to live in, both for sort of their health and for the climate.
Lovely, and I can't wait to get into discussions around that. I'm sure it'll come up from other people in the Q&A as well. Is Tom Dawson on the call? Tom from Revolution Zero. I don't know if Tom is on the call, actually, isn't he? I thought he hasn't popped up, but Tom should be speaking later on this afternoon in the consumables section, and Revolution Zero doing some brilliant work. So apologies, I don't think Tom's on this panel, but do check out his work later on this afternoon. Martin, again, another institution that I'm hoping to bring to life because I've been interacting with IEMA. I don't know if that's the right way to pronounce that acronym, but Martin, over to you.
Great effort, thanks Pete. So I'm Martin Baxter, I'm Deputy Chief Exec at IEMA. We're the professional body for people working in sustainability. And a big part of my role is supporting the development of skills and competence so that people can drive change for a sustainable future through the world of work. As part of that, we also support wider workforce transformation through things like our All Jobs Greener programs, and we have a number of corporate partners who are in either in healthcare. I engage quite a lot across government, so heavily involved in the development of policy and legislation here in the UK, but also I chair groups internationally on developing global standards in the 14,000 series. And, a big part of what we do is cross-sector collaboration and learning, because I think whenever we get sectors together, there's always like a deep expertise, but there's nothing like learning from other people who tackled a problem from a different perspective. So that's a little bit about me.
Lovely, thank you. And you're absolutely right. I'm certain that the topic of education and skills and knowledge will come up today. I've certainly got a question bubbling around in my head on that very thing as well. So thank you, Martin, for your time. Janet, over to you next, please.
Hi everyone. I hope the background noise doesn't
no, we can't hear a thing.
From the discussion.
Perfect.
Yeah,
no.
Great. I'm Janet Smith, Head of Sustainability for Royal Wolverhampton NHS Trust and also Healthcare NHS Trust. My work, I'm basically tasked to ensure that the trust gets to net zero by 2040 and 2045. So that's what I do. And when we're talking about challenges, there's lots and lots of challenges that I can share with the group and also how we overcome them. Thank you.
Lovely, thank you for that. And then unfortunately, Gemma Heath, who's the Sustainability Manager at Salisbury NHS Foundation Trust, just messaged me this morning. She's there's some work that she needs to finish, some urgent work, and I think I do sympathise. I've been talking to a lot of sustainability leads recently. There is a lot of people under strain of capacity, and I know that happens across all of the NHS and the front line particularly, but I know people in sustainability also feel that those capacity pressures, because it's such a big topic. So Gemma, I know that you can't join us today. I'm hoping you might catch up afterwards and at least listening, and I'm certainly going to be connecting with you as well. So let's just open it up. The other thing I think I've sort of mentioned already, but I'll just reiterate again. I wanted this session to be really authentic. That's why I didn't want to script some questions. I've been part of panels recently where, you do prep and will you ask me this and do that? And that's fine. And I get that. But I quite like authenticity. I like, and I want this to work for people here as well in the chat. But I know what it's like as well. It sometimes takes a while to get people to kind of feel confident to start asking the questions. And actually, some of those questions might materialize as we get into this discussion. So I'm just going to kick off with a few things. Now, I'm going to start off with one of the questions that plays on my mind. I mean, net zero is such a complicated topic. It's so multifaceted. And I often get climate anxiety. I go through stages of feeling really optimistic and then really kind of like, worried about it. So I'm just going to have an open question, and not everyone has to answer this, but if you feel confident, I just want to know what keeps you awake in terms of this agenda. What keeps you awake in terms of what worries you? Where do your concerns lie in your role? If people just wouldn't mind opening up a little bit in terms of that. So let me have a look. Who's feeling confident to? Excellent, Sam. Thank you. Good.
Somebody has to go first, don't they? I think for me, as you say, you go through, negative moments and positive moments. I think the biggest anxiety for me is the larger stuff. Is for our site at Harrogate, the strategy to fully electrify the site. Really big, kind of complicated schemes that are going to require a lot of funding. With the SALEX funding being challenging to get hold of, shall we say. I do have anxiety about that because we obviously have a strategy to degas the site. It's something that I can't control necessarily, so I have to kind of sweat the small stuff. Look at what I can control. Look at the engagement pieces in the travel plan. Getting my colleagues to be thinking about sustainability every day. Looking at the travel plan and doing those small incremental steps. And gathering momentum with what is perceived as the smaller stuff, but it's stuff within my control. I think that's probably how I'd answer your question, Pete.
Thanks. Yeah. So obviously, like you say, the electrification of and the decarbonisation of your estate. But I think you're absolutely right, and I've seen this before come on or come up in terms of strategies and coping strategies. Yeah, like you said, the things that you're in control of. I also think there's a lot of merit in just not trying to do everything all at once, and a bit like what I tried to mention in my opening presentation this morning. Innovation does take time, and some of this does take time, but just kind of getting the cogs ticking now is really helpful. Keith, what do you want to add to that?
Yeah, I think the point for me is we've got scope 1, 2, and 3 when we're measuring carbon, but I think it's useful because we've got so many players and actors in this whole schema that have to do something in their own bailiwick to contribute to the overall picture, particularly for the NHS and the net zero target. And I think what scares me is whether people really understand where their sphere of control is, that they're really responsible for, where their sphere of influence is, that they should be pulling levers with other people to do the bit that they're responsible for, and where the sphere of interest is. And that's where we pull out into regulatory policy, patient, public perception, all the rest of it. And I think that's the bit, given the urgency of what we're trying to achieve for the NHS and the timelines on the targets, they've done a fabulous job in the Greener NHS team to engage the supply chain. But I'm not sure yet people understand what is really in their gift and the realm of possibility to deliver in the timescale available.
I'm going to come back with a follow-up question later on, but I'm going to let everyone kind of chip into that, because what I want to follow up with is how do we help them then, Keith, with that challenge that you've identified. But thank you for that. Let's go around the room and keep hearing what keeps people awake. I'm glad people have got their hands raised. Peter, I can see your comment in the chat as well. Obviously, you're here to listen in, but I know about your role as well, so it'd be good to to get you on camera. Maybe if you're feeling confident, just ask a question of the audience and share your expertise as well and thoughts. But Dave, over to you next.
Yeah, thanks. So the thing that was keeping me awake last night actually was just thinking to today's session, and you mentioned, Pete, about the complexity of dealing with this challenge. And the thing that I suppose, so I, as an advocate for the natural environment, I do worry about that adds an additional layer of complexity into it. And I find that the beauty of nature and green spaces and trees and our rivers is that they provide so many benefits for so many people in so many different ways, but actually they often play a small part in lots of different pieces. So it's trying to integrate that into thinking in a way that doesn't overcomplicate how we work. And something that I'm sort of really interested in this space is the sort of the innovative governance models that we can bring, which link up, the healthcare side of hospitals and hospital estates with the net zero goals and sort of biodiversity goals. So how we can get people in the same room to actually have those conversations, so we don't deal with our own problems in little silos.
Lovely. And again, I'd like to sort of, I think that's a really good, honest reflection. If we think about the health and social care system, I've been in it for 15 plus years. It's gone through lots of reconfigurations. It's just gone through a recent one. I think at the heart of that is that desire to get people connected. If we think about like integrated care boards within the NHS, that was kind of why it was, trying to do that. But like you've just shown as well, there's lots of other stakeholders that we need to bring in on this very complex, multifaceted problem of net zero. I'll take a few more, and then I think I've got some hands up from the audience now, which is brilliant. Just before I go around to the rest of the panel, I think this is an AHSN colleague or two. Amelia, was you in the room? I think Amelia was just in the room a second ago. Lovely, Amelia. Would you do me a favour? Could you just keep an eye on some of these comments
Of course
as well,
I will.
and then bring them in as well? Amelia is a brilliant person for those that haven't met her. She's the sustainability lead down at Kent, Surrey, Sussex and Oxford AHSN. She has 2 AHSNs to look after, and she's also looking after me today with the chat. So thank you for that, Amelia. Martin, please come in.
Yeah, I mean, I think the thing that keeps me awake at night is the constant missed opportunity to deploy the solutions that we already have, which means that we're going to have to go back and redo it again. And that is the most dispiriting, I think, of all the things, because things that you can't do or you don't know, kind of, okay, well, you kind of that's frustrating. But actually, when there's a solution that should have been implemented and that gets missed and it doesn't kind of form part of a project or a program of change. And then you're going to lock yourself into something that's suboptimal for the next kind of investment period. I think that's the bit that really, really kind of hacks me off, because this is a big organizational kind of challenge that we face. And largely the technical solutions are pretty well known. And therefore that's the bit that kind of, people.
Well, again, Martin, I don't know whether to jump into that question now, but bring to life an example if you could then. Just give us an example, because I think there's something bubbling around in your head. So bring that to life, because it's a very good point.
Yeah, I mean, I've seen it where people have a project and they kind of they can create, a way of generating power and generating kind of massive efficiency through installation and all the rest of it, and then so what the solutions need to be to give a kind of a complete solution on a new build, and yet part of it doesn't get delivered because there's a budget cut, or there's a kind of a slicing off of some finance, and therefore you kind of end up with only part of the solution kind of coming in, and therefore you're going to have to go back and retrofit in the future. You see it quite a lot, and I think that it's things like that which are really, really short-sighted.
No, well, it's a comment that's resonating with people in the chat, I can see. I often use the phrase in other sessions that, and maybe it's a bit sweeping statement, but I do say that we've got many of the solutions to fix society's problems already. That's not the problem. It is some of those kind of other challenges, the funding, the perverse incentives, whatever it might be. That said, I do think there are lots of innovation things happening where you think, yeah, that's a build on something the way that we currently were doing it, and now we've improved it. It's that like continuous improvement. I was going to mention another quick thing, and I've lost my train of thought now. But yeah, let's keep going around the room. Then Jonathan, you come in, and then we'll take one more from. Sorry, Janet first, and then Johnny. Janet, you come in, and then I'll say we'll open it up, and I'll let Amelia throw in a few questions too.
Yeah, I think the one thing that keeps me awake really is looking at messaging and communication to our staff and the rest of the, particularly within execs, trust execs, TMCs, because we do need to have their buy-in in whatever we do. And the issue is that if we actually don't get that messaging right, then it is going to, that opportunity slips. Like at this time, everyone, let's say everyone is saying, the world is actually boiling, etc. But then the reality in the UK during summer is we were wearing our almost our winter clothes. So it's that whole messaging needs to get right. And at the same time as well, the biggest source of our carbon footprint at the moment is our supply chain. And I know Keith mentioned it, but the reality at the moment is the supply chain is not actually mature enough to provide us with their LCS or with their environment certificates, etc. And they are nowhere near that, because I attended actually an event 2 days ago where they're still talking about data, they're still talking about disclosures, they're still talking about transition plans, and not much of them actually has that in place as well. So where do we go in terms of the NHS? We're trying to reach net zero by 2040 or 2045 for NHS carbon footprint plus, but our supply chain is not ready. So where do we actually meet? And that's what keeps me awake, because that is like 45% of my carbon footprint.
Lovely, thank you for that. As I say, I think there's a theme developing around skills and knowledge and competencies that I want to come back to as well, and bring Martin in and get some thoughts. Johnny, your kind of thoughts. What keeps you awake, and then we'll open it up to questions.
Yeah, thanks, mate. I think it's kind of cuts across what many people have said previously, but the target of 2040 for the NHS to become net zero, it feels so far out in people's minds that trying to get funding prioritised to look at these solutions now is what is a real challenge. You're trying to balance that with the needs of delivering clinical services. So as Martin says, there's lots of things we could be doing now. It's trying to bring them forward. And I guess the other thing that keeps me awake from a kind of our schemes perspective is we're designing a building that's got a 60-year lifespan. So how do we design for the future climate scenarios as well in the future, and trying to again make them feel real today, so that we can get the right funding and the right decisions really to do the right things now.
Lovely. Again, I'm going to open it up to Terry, if you wouldn't mind just introducing yourself, Terry, as well. And what I'd like the panel to do is just reflect a little bit on what's been said so far, and because I think we've all got thoughts that can complement this. You know, like you said, that was a very good call to action as well a bit, Johnny, wasn't it? That you know, that how do we help people plan for the future? It's the same with like models of care. If I think about how the NHS is currently delivering care, and the theme that we've just done this morning, there are so many brilliant ways to change the models of care. And a bit like Martin suggested, you know, we kind of got a lot of the solutions to make things slicker and quicker. Terry, come in, please do.
So yeah, hi. I know this is about hospital care, but I'm a GP and I run the Green Impact for Health Toolkit for general practice. And I'm going to just say what the problem is, give you an example, and then ask the question. The problem is it's what I would call the green bubble problem, and that's the fact that if I use, you know, we've the huge gap between what needs to be done and the reaction people are taking to that problem. So if I give you an example. We've been running our Green Impact scheme in the UK for almost 10 years. You get about 1,500 of the 10,000 practices sign up over the years. In those 1,500 practices, 2/3 of them actually take no action at all because it's one single GP or practice manager against all odds trying to do something in a completely unfunded way, trying to drag everybody along with them in the, you know, overburdened NHS as we know it. So there's that problem, and the question is to really make progress. We've got to get the hearts and minds of all our staff in the NHS to make progress, and we're just doing that too slowly. So we've got a small green bubble, whereas we need a huge green bubble. So the question is, how on earth do we successfully motivate all our staff and people in the NHS to start making the transition both at work and at home? I know it's not an easy answer, but that's my question.
Very good question. Does anyone want to have a go at answering that? Keith, I think you've got your hand up from a previous reason, but did you want to have a go at answering it?
Yeah, please do. Yeah. I'll answer hopefully Terry's question a little bit and a point that Janet raised as well. The issue with supply chain readiness, I think, is a similar issue to the one that Terry's raised about incentivizing and enabling people to react inside the system. The problem that I see is the timescale, the urgency of it. I see supply chains moving. We've been invited in the SHC to join a thing called the Sustainable Markets Initiative. It's under the banner of Terra Carta, the then Prince of Wales, now King Charles, set up this thing to help convene industries to get together and think about how they contribute to a sustainable future. There's one for the health systems. The Health Systems Task Force has set itself several challenges, one of which is to set up a system for measuring LCAs, to perform LCAs in the pharma sector. Until people started asking for it, they were doing their own thing and very happily doing it because they knew that they had their own internal climate targets and sustainability targets to meet, and they weren't going to be able to do that unless they could understand their own products and processes. The problem now is making sure that the processes that industry use are going to be acceptable as an evidence pack to provide to the NHS and other stakeholders. They've set this program up to start to build an LCA framework to measure pharma, but it's got a 3-year timeline on it. So it's going to be 3. We've engaged the NHS, they've engaged the British Standards Institute and others to try and make sure that's an acceptable framework, but it's not going to be available for 3 years yet. So there's got to be something in there that says we'll use whatever you have now and then worry about its acceptability afterwards. Otherwise, we're not going to get there in time.
This is it. I mean, sometimes let's use what's good enough. Also, I think sharing knowledge. Again, carbon accounting life cycle analysis is a piece of work that I'm still looking at. I think there's some brilliant innovation out there. We just need to kind of uncover it and bring it to light and show that there's a need for it. Martin, I'm glad you put your hand up because I was going to bring you in actually. Sorry, just to talk about the skills.
Can I just have a quick, because it's related, I'll just answer a little bit of Terry's question as well. As Terry knows, because we've worked together in the past, one of the things that we've been trying to do as well is tool people up. to get people easy access to understanding sustainability assessment and how to go about doing it. So one of the things we've done is build a GP carbon calculator, which doesn't look at the clinical aspects of GP surgery, but it does look at the business aspects, the buildings, the staff, the travel, all the rest of it. And that sort of thing is great because it allows people simple entry to try and educate themselves, but also to try and hotspot their own activities and things like that. We're working with Greener NHS to refresh something that we call the Care Pathway Calculator. And those sorts of tools, simple access tools, is one of the ways that we can educate people and engage them and enthuse them, hopefully, to get on this journey with us. So there's a little bit of an answer for Terry.
Thank you, Keith. And Terry, just a couple of my thoughts before I bring Martin in. I've seen innovation around changing behaviour to do with net zero. There are a couple of innovators that we're working with and been successful with funding, with SBRI funding, to help think about behaviour change. So you're absolutely right, we need that. But education is also at the beginning of that journey as well. And again, I've seen everything from light touch, quick modules, half an hour, it doesn't take too long, right through to more intense training and technical skills. And I think probably what Janet was talking about, how do we get the board and the leadership upskilled? So Martin, just bring to life some of the work that you do, how we can increase people's knowledge and get that behavioural change.
Yeah, and I think, this is right at the heart of this, because, ultimately everything that we want to do is going to be about change, and it's going to be people who are going to have to drive the change. And people not many people like change. So kind of being able to articulate how they can, through the work that they do and the role that they play, they can drive better solutions for sustainability that actually kind of benefit patients. And, I think making that connection and making it real to people is kind of of vital importance. Some of the work that we've done, I mean, we've worked with NHS trusts across Scotland on initially anyway, but kind of more broadly now on a pack for NHS boards on how they can start to think about sustainability in the round. And I think that's really important because, if you can start to get that buying, that understanding from people at the top, I think that's vital. I think we've seen it where I've seen it working really well is where you start to integrate this thinking into key roles. And I go back 2013, I think it was 2012, when nurses being trained at the University of Plymouth were being taught about resource efficiency, about how they can make how the choices in the way in which they deliver healthcare actually kind of benefited resource efficiency by kind of using less materials, reducing cost, and therefore there's more available resource to treat patients. And it's kind of making that really clear and explicit, and just picking up Johnny's point about, when we're designing, the facilities of the future, when we're delivering healthcare of the future, kind of thinking about, well, what does that mean in a climate where we've got far more extreme weather, where we've got kind of bigger challenges that we're facing down? So how are we going to help people? And, and Dave, kind of when he was talking around nature-based solutions, nature-based solutions are a fantastic way of helping kind of to deal with this. So I think it's when you start to put it in the context of sustainability is all about delivering for patients, and we can do this kind of, and it will have massive kind of benefits. That's when it becomes quite powerful. That does require a bit of a bespoke kind of approach to learning and development. Because as Keith kind of talking about LCA, we don't need everybody to know about LCA. And actually kind of, we don't need that many people doing LCAs in particular areas. What you need then is to bring that information and that data into decision making. So we don't need everybody to spend all their lives kind of crawling through, 2 years to do an LCA of X. It's like, well, let's do that once, and then we get that information. Then it's like, this is where the biggest change can be made for the biggest benefit. And this is how we can do it. And then let's get on with delivering it. So I think it is about enabling people to drive change through learning and development in a way which they can see is core to their role and function.
Absolutely. And like you say, sometimes just complementing some of this education with simple facts and figures and easy access to information can help drive that behaviour change. And again, just why I wanted to at the beginning calculate what the carbon footprint would have been if we'd have had this face to face, you know, just to give people a flavour, because without that, people have got no reference frame of reference. Janet, Tim, I can see that you've got your hand up. I just want to kind of keep the theme maybe just around behaviour and education, and then I'm definitely going to bring Amelia in to throw some comments. So can I just ask you, is it around sort of behaviour and education that you want to come in on? Lovely.
Yes.
Yeah, excellent. Janet, you come
Yes.
in then, Tim, and then I'll hand
Yeah.
over to you, Amelia, please.
Yeah. I think when it comes to our experience basically when it comes to getting staff to buy into sustainability and doing sustainable initiatives is that what we did was actually making it real for them, like what Martin said. What is me and my role as a waste management operative? How do I actually contribute the daily things that I do? How does it contribute to the trust reducing carbon footprint? If I'm a domestic help, so that's how we do it. We present to them service by service, because each service have a unique thing on its own, and also making it real for them that what are the things actually that they do that contributes to the trust carbon emissions, and what can be done about it. So it's that way of making it real and making it also their responsibility to do something about it, because this is their service and this is what they can do as an individual, as a member of a team, and also as a member of the trust. So that's how we do the messaging, and so far we've been successful in it. But the other side of it is that when they actually start doing initiatives, you should also be there to support those and facilitate it getting done, because when you encourage people, they're so gung-ho on doing something, but right at the end then you don't do anything to facilitate that happening, then it just falls down. And the next time you talk to them, they won't believe you.
Yeah, absolutely. I'm an absolute advocate for supporting people. I often say, look, just reach out. Sometimes I know that there's brilliant people have already kind of worked through some of these challenges. It's finding out who to ask the right question to, and get that support, like you say, so that this isn't left. Tim, finally to you, and then I'll say we'll hand over to Amelia.
Yeah, and forgive me if people are already doing this. I can only relate it to my trust. I'm really kind of thankful that I've got a learning and development department who are engaging with me, and we're working to get sustainability awareness on induction. We're going to get it as part of their mandatory training as well. There's sustainable training on our e-learning modules, so that will be a great start to engage with staff, new staff and current staff. We are also putting criteria in our business decision-making process to have a sustainable criteria there. And also we're just delivering a new quality improvement process as well, and I'm going to have a theme of sustainability in all our quality improvement programs going forward. So it's just a suggestion for others that get in touch with your learning development department, your quality improvement department, and bang that door down.
No, absolutely. A really good point, because as you well know, when I advertised this Green Hospital session, one of the things I tried to do, and I'm not sure how successful, was not just get the sustainability leads coming here today, but actually how do we get the HR leads to think about some of this, because it's again, it's multi-department, this challenge. And as I said, I've started doing a lot of different environmental sustainability training courses because I like to see what the quality is like. So I've done everything from really simple right through to a bit more complex and everything in between. And actually, as a learner, being reflective of the quality of that and feeding that back and constantly shaping it, I think is really important. Again, as Martin probably well knows, it's a complex landscape out there in terms of standards and training, and I know that people get confused. One of my colleagues reached out to me and said, what should I study? What should I do? So we need that sort of hand-holding as well. And I know NHS England, the Greener NHS team, have tried to do some of that as well. Amelia, let me bring you in and just see if you want to bring some of these brilliant questions to life.
Yeah, of course. So there's some brilliant questions and conversations going on. And one of the first kind of comments is from Peter, which I think is really, really fair. He says, as a realist, it could be quite pessimistic, but he said, we're not where we're supposed to be globally or in the NHS. And there's lots of talking, but little action. So I just kind of wanted to bring in any NHS colleagues and respond to that. I mean, personally working in the Academic Health Science Network, I'd say it's a really complex area. We're having to build the ship as we sail, but there is a lot of action going on behind the scenes that the public may not see. But Johnny, please jump in.
Yeah, again, it's a really fair question, and I think from my perspective, I'm in a fortunate position that I'm working on a new building rather than looking at kind of existing estate and how we deliver this operationally in existing estate. But the one thing that we seem to have done really well with this scheme, and it links into the previous conversation, is that our exec board are really on board with what we're trying to achieve. So although we have a target as an NHS to deliver net zero carbon by 2040, our board are well engaged with the issues and have mandated that our scheme, which is due to deliver in 2030, has to be net zero carbon from day one. So it's trying to emphasize that action from the off in the design, really, is what we're trying to do there. So again, just to, I guess, promote a slightly good news story out there, that we are trying to focus from new build perspective. How can we embed this at day one and not look at it as a retrofit in 10 years time after opening?
Brilliant, thanks so much, Johnny. Janet.
Hi, in terms of what we have done for estates, we are actually actively decarbonizing our estates in terms of the heating system. So we've been quite successful in PSDS funding. So it's we're installing heat pumps. Have an LED program. We also built a 31-acre solar farm. And also, in terms of procurement, our procurement team actually does sustainable impact assessment on everything that we buy now, asking for LCAs. If there's no LCAs, at least a good data about the embodied carbon or logistic carbon of the products. We're switching to sustainable products. At the same time, we're decarbonizing our clinical services, which is throwing up. Come to think of it, we're addressing our business as usual, and actually it's throwing up a lot of cost improvement. So case example are theater hats at the moment. It's saving the department £116 a month. So although that's little, but also our waste and recycling team has actually got 85k cost improvements in the last year. So there are a lot of things that you can do with business as usual.
Yeah,
and
yeah. Excellent. Thank you for that. I'm just going to carry the conversation on finance. So thank you for talking in numbers and financial, because I know, Peter, you put something in the chat, and Tim and I have been talking about this. And then I think there's a question in the chat around, different funding models. So I'm keen to understand, and I might ask you, Peter, just to bring your question to life a little bit more around the financial landscape. But it seems like we've got barriers about how we might fund things. And then we've also got people thinking of alternative funding models. How can we help people navigate this? Why allow funding to be the barrier to what is essentially a very important issue to planet Earth? So, Peter, I don't know if you want to bring to life your question a little bit, and then we'll ask it at the panel.
Yeah, so I'm hitting brick walls all of the time when I'm having these conversations with colleagues. My understanding is that foundation trusts can borrow money up to a certain extent, but standard trusts cannot. So there's a barrier straight away, and it's insurmountable by the sounds of things. All trusts have got a CDAL limit, a capital departmental expenditure limit imposed by central government ultimately, which you cannot go beyond, no matter how good your business case is. That's my understanding. So you've got this situation where your only option is to go for Salix PSDS money, but that can only be used for heat decarbonisation primarily. So if you had an amazing solar scheme, for example, that would pay back within 8 years, there's no route for funding that, absolutely no route whatsoever that I can think of, because even if you got a third party to build it and then signed up to a PPA, because it would be via a private wire, that would be, I guess, an allegation or a claim that that asset is within your boundary. So it would be treated as like an embedded lease of some description, and then would have to be capitalized under the current rules. So what I keep saying to people is we're never going to get past this problem unless we lobby the ICBs and ultimately government and central NHS for them to make changes to the rules.
Peter, I would love to connect with you outside of this meeting. I'm sure others would. Again, just because we're not going to be able to do this topic justice in this panel, but you're absolutely right. How do we start thinking through the challenges and just absolutely clarifying our mind that there are absolutely barriers, that there are alternatives, what we might need to do to raise these issues? Because it just strikes me as well, and as I said, in such an important topic, why we've got financial barriers that are causing the problem. And as I say, I think we've got creative funding models out there and other institutions being able to access funding. So I'd love to connect with anyone that's interested in the topic of funding net zero innovation, and not just like state infrastructure projects, but across, you know, the wider footprint. Does any of the panel want to come in quickly on funding? As I said, I don't think we can do it justice today, but anyone got any other reflections? Janet?
Yeah, just a quick one, really. Yes. One of the things you could do, Peter did say about approaching the ICS with regards to PSDS. Our trust actually lead an ICS-wide bid for PSDS funding, and that was actually funded. So that is an opportunity, because I think one of the things as well that stops boards from supporting a bid is the abortive cost, that if you don't actually get funded, then the money you spend in pulling together that bid becomes an abortive cost. So that is an option to actually explore with your ICS, whether they have an appetite for that.
As I said, this topic massively interests me, and I want to almost pull together a few people just to kind of think it through a little bit more. Let's move on a little bit. Unfortunately, Amelia's Wi-Fi dropped out a bit. Griff, I know you had your hand up a while ago and just put it down. I don't know if there's anything that you wanted to bring in. I was going to maybe just go back to the nature topic as well, Dave, and think about, obviously the NHS is under massive pressures. You know, we see on the news issues with waiting times, industrial action, things like COVID, backlog, well, the winter pressures, etc., etc. Is it unrealistic to try and throw another topic into the mix and get people to think about nature and its benefits? Because the evidence is there. You know, I really want to live in a world where, and in fact, I joined a session by Natural England this week, green in our urban areas. We've got some real deprived communities, and our hospital and community facilities are in many of those areas. It feels a no-brainer to green. What's holding it back, and are we throwing too much at people, Dave?
Yeah, I mean, you could argue we're throwing too much at people, but actually it's probably, I'd flip it around and say, can we afford not to think about this in the round? So we know that access to nature has many health benefits, and actually those health benefits are actually part of the sort of prevention rather than the cure argument. So green social prescribing as an example, and the benefits that can provide for people's health and well-being, which can keep people out of hospitals, and studies actually around, you know, views of green spaces within hospitals reduces the length of stay that people have in those institutions. So actually, I think it's got to be part of our health strategy for the country. So the Department for Health's recent sort of major conditions strategy that they've putting together recognises those wider determinants of health, of which access to nature is a key part. But I think the challenge, you know, often is that this is probably in silos. So the green social prescribing and the social prescribing world more generally sits within the sort of those clinical care pathways, but actually has a positive carbon story in terms of the reduction of medication that needs to be taken and the footprint, you know, therefore on that side. But actually, across government, there's a challenge, and something we're working on is actually trying to do this join up. So a concept of everybody living within 15 minutes of nature was part of the government's environmental improvement plan published sort of earlier in the year. And actually, if we view access to nature as a health asset and parks and green spaces as health assets, and we can start to model the benefits they provide, you know, we can actually start to build a bigger sort of health picture across the piece. But that's challenging. See, even in government, a parks policy, for instance, sits with the Department for Levelling Up Housing and Communities, which is separate to DEFRA, which deals with environmental improvement, and is separate to the Department for Health, which obviously deals with the health side of things. Yes, it's a big challenge, and I've probably overcomplicated it, even there. But actually, I think what we need to do is sort of really pinpoint some of those flows. So actually, decarbonising the NHS, actually reducing the amount of time people spend in hospital settings, reduce the amount of prescription medication that's taken, have carbon benefits, have benefits for the environment more broadly. And actually, I think just coming back to that piece about how to engage people in net zero and the climate crisis and the role the NHS is playing, I think creating spaces where people can convene and talk about these things is really, really important. So the NHS Forest done some great work and is continuing to do great work around tree planting and in creating green spaces on NHS sites. And I think those spaces can, in and of themselves, they can address the climate crisis and address biodiversity crisis, but actually they can also be spaces where we can use to engage people in the wider picture. So I think that's something to consider. I think in all of our work, actually, where are the spaces we can create for people to get together and share their stories, as well as feel those personal benefits.
Well, thank you for that. And one of the sessions that I'm planning, I think it's the 16th of November, but don't quote me on that, is around investment in nature and things like carbon offsetting, which I think has got massively overcomplicated. But for me, it plays a role in our net zero journey. So I'm going to be shining a spotlight on that. I would love people to connect with Dave, and I'd love again to help you, Dave, facilitate these conversations. And just a really quick thought from me. I saw one of the companies earlier on in the sessions that are just using natural light to bring light into buildings through an innovative process. But even if you take the humble tree, the tree cools things down. The evidence is there that it has those cooling benefits. So when we're applying technology to cool our buildings, just having trees around them would probably massively help. So I think what I'm saying is, how do we help the NHS green its infrastructure and the communities it's in to show those benefits that will then hopefully not require as much technological solutions. So anything you can do with that, perfect. Sorry, Griff, I know you put your hand up, you said you wanted to come in, you put it back down again. Do you want to come in quickly?
Yeah, just a very quick point, thanks Pete, and really just picking up on Janet's point around the importance of supply chain in the context of carbon reduction. I'm just curious, when it comes to tendering opportunities for your suppliers, to what extent are targets around carbon reduction being set and then enforced? Because to my mind, the best way to get people to do something is make the money contingent on them doing it and then policing it. And if they don't do it, they don't get the contract. So it feels, obviously, when we're talking about new built environment and retrofitting things into existing hospitals, it's a bigger topic which requires big funding. But I'm just thinking about the sort of operating expenses in your procurement and what levers you folks have got to really drive this through your supply chain. Because if the money stops, they haven't got the business. So there doesn't seem to be any better incentive than getting things moving in that context.
I mean, if I can come in on that, Pete.
Please, Johnny. Yeah, please do.
Yeah, again, Griff, it's a great question, and I think what we're trying to do with our scheme in particular is get that as a key metric early on in that procurement. So part of my other role is looking at the digital hospital, and again, it's quite an energy intensive industry, is providing technologies in healthcare. And one thing that we're really kind of key of trying to bring into kind of our quality measures during a procurement is the sustainability agenda. So what are organisations looking at from the way that they provide their own services as an organisation, but also what are the benefits that their solution may also provide to us in our scheme as well. So we don't have kind of set measures or anything developed at the moment. We're still kind of in a concept stage of our scheme, but we're starting to try and, like you say, educate the supply chain and make them see that there is an impact actually on business going forwards if you're not considering these elements as part of your operations as well.
Can I just jump in on that?
Sorry, Pete.
I was just going to jump in on that. It's been a long time since I was a procurement stroke contract manager, but I remember it's one thing to be able to build in those questions into the procurement and tender and try and select the right person based on their answers. It's another thing holding them to account once the contract's up and running. And it's not easy. And this is it. And sometimes, like the NHS standard contract, which is obviously predominantly the contract that's used in a lot of commissioning of services, doesn't have those levers that allow you to fully manage it, maybe how you're suggesting, Griff, about non-delivery. Obviously, you've got exit clauses in there, but I think, you know, just my reflections, and it might have moved on since I was in procurement and commissioning, but let's try at least get it right and strong at the beginning in the tender process. You know, let's really try and think about the weighting that we're giving to that, the quality of the responses as well that's coming through. So
we see the same thing in education. So increasingly, universities have got net zero targets, and one of our clients was successful in getting a bid for university catering. I can guarantee you that all the other successful clients will have answered the carbon answer in exactly the same way. Our client can show the difference. Questionable if the others can. Now, that only matters to them if the tap gets turned off, if when it comes to show the impact in terms of carbon reduction is actually policed, you know, throughout the contract length. So that's key.
Well, do you know what? Again, I appreciate the question. I can see that there's lots going on in the chat and people are connecting, but let's try and think about these things that we've asked today and find out some answers. You know, again, I'm looking at some of my NHS colleagues, and let's just think through who's done those contractual agreements and arrangements well, if there's any examples, and do we need to strengthen that? I think I said I was going to finish at 12:50, because obviously other sessions are starting at 1. I know, Amelia, I think you're chairing, maybe, I don't know if you're chairing the one at 1 or later, but let's try and start wrapping up now. I can go on till 1 actually, so we don't have to worry that we're slightly over time, but let's try and just wrap up with some final questions and some final reflections. I am just going to open that up just to see if anyone wants to reflect and ponder from what we've discussed today.
If I can.
Thank you, Martin. Sorry, I'll let Martin come in.
Well, just very quickly, I just wanted to pick up on the comments from Dave around the benefits to patients, and it's kind of really germane. My mum went into the hospital 5.5 weeks ago for a 1-day elective surgery, and she's still there. She hasn't seen daylight. She hasn't seen the outside. Hopefully she's going to be discharged this week. And yet I walked down the corridor and I got a fantastic view of the Pennines from Oldham Hospital. Okay, so why do you give people in a corridor the benefit of seeing fantastic moorland, and yet the patients are all facing in at each other and they can see absolutely nothing? So there you go. That's one of the reflections that I've had, and you know, and Dave kind of nailed it. You know, she potentially would have recovered quicker, and she wouldn't have had the delirium for quite as long and all the rest of it. So there you go.
Thank you for bringing that personal
case that kind of speaks to this issue. About design.
I was just going to say the same thing. Thank you for bringing that personal story to light, and actually people like Johnny who are developing hospitals of the future and planning. It's absolutely essential to get that thinking. Johnny, what were you wanting to come in on?
Yeah, I mean, just to the one point, I guess, from what we're trying to do with our scheme again is, and it kind of ties a little bit to the piece that David's mentioned about kind of, you know, bringing nature into scheme, but also kind of contractual deliverables, is we're looking at building standards that we can hold people account to delivering against. And there's a building standard called the Well building standard that we're mandating in our scheme. And what that is trying to do is not just look at kind of carbon intensity and energy provision, but look at the wider sustainability benefits of bringing nature into the scheme, bringing daylight into schemes as well, because the way we're trying to frame this, and whether this is something that, you know, might be a discussion outside of here, is trying to frame sustainability not just from a carbon benefit and the finances, but what's the health outcomes. And I think that's the argument we're trying to put forward for our scheme to get investment, is what's the health outcomes ultimately.
Do you know what I said earlier on? I'd lost my train of thought, and I remember what it was now. It's how do we connect other people up, because we've got lots of innovators, but those innovators might not be the ones that win the contract, but yet they've got something to offer that contract. And I think this is where all the time we've got to bring people together, because that's sometimes a problem, isn't it? That as I said, in terms of procurement and commissioning, you commission that, but it's not quite everything that you would have loved to have seen. But if we can get greater than the sum of the parts. Keith.
Yeah, thank you. We've done loads of case studies trying to test whether the tools that we've developed in the SHC actually work or not. And time and again, we find that the lower carbon option is also the cheapest option, has the best clinical outcomes associated with it. And it goes back a little bit to the comment that Martin made earlier about a lot of the solutions we need are here, and the comment that Janet made about how you disseminate and incorporate these and get wider uptake of these solutions. And I think that's where the key focus has to be. We're not going to be able to invent very many brand new technologies between now and 2030, 2040, but we can deploy better what we've got. And these finance barriers are one of those things, and servitization of products and assets is one of the ways forward. And I'd like to see a lot more effort in there.
Good, and I'm sure you can influence that, Keith, in your role at the Sustainable Healthcare Coalition. This is what we need: these kind of big institutions to influence these kind of different ways of delivering. Janet, I'll finish on you if that's okay, and then we will definitely wrap up.
I just wanted to say basically that for us, innovate from business as usual, because innovation is not just about new, but actually making what we already do better and bringing in technology, training, education, and everything else into the mix. Because at the end of the day, at the end of it is patients, and it's about patient outcomes, and it's about better care, excellent care. So that's where I end.
Lovely. Thank you for that. Nice way to finish. Yeah, I mean, just some final comments from me. And I often say this to people, but don't struggle alone. As I said, I can see a lot of people connecting in the chat. We must keep connected to each other. As I said again in my earlier presentation, if there's something that you hear that's not your remit, share that knowledge. If there's another corridor conversation that we need to have outside of this meeting, let's facilitate that. Thank you for being part of the panel. It's always the case, you could go on all day with these, but as I said, I can see some brilliant connections in there. Obviously, we've had brilliant people part of this panel. I've got the privilege of knowing these, and as I say, I have many conversations with many of you, don't I, in others, and some of you I'm just kind of building those relationships with, and it's important for me to keep that connection. So thank you for your time. Please join the afternoon sessions as your diary allows. You're going to hear from probably about another 20 innovators, and then we're going to do a final wrap up at 3 o'clock in the main room, just with some reflections. And then maybe a bit of feedback and close. So thank you everyone for your time, and appreciate your dialogue in the chat.